When I think back to this must have been 2010 or something like that, there was a big run at something called personal health records, PHRs. Google had one, Microsoft had one. There were a few other companies who tried to start them. And the challenge at the time was there wasn't great tech and APIs didn't exist, and patients wouldn't have been able to be facile enough for the most part to be able to sort of pull that data down. There wasn't sort of gateways or APIs, things to let that happen. But I do think I agree with you. When you look at the future, the ideal situation would be to have patients be the stewards of their own data and make the decisions about what data could be released for what, because it is our data. I mean, it is our information. I know we've grown up in this environment where hospitals collect this information as they treat patients or they're in the hospital. And so they feel like it's their data. But I think the reality is it's the patient's data and they should be in control of it. And the best way to do that ultimately is through this PHR idea, not
So the
PHR, but whatever we're going to call it in the future.
Yeah, we got to be careful here because it's not our data. It is the health system's data. By law, it's whoever creates the record, it's their data. It's data about us, but it's the health system owns the record because they created the record. That's the case in 49 states. The only state that's not the case is Vermont. They passed a law where the patient actually owns the record. People say this to me all the time, and I hear people out there saying, "Oh, the patient owns the record." I'm like, they don't own the record. They didn't create the record, and the law states that whoever creates the record owns the record, even if the information is about you or me. If I write information today about Drex, I own the record because I created the record.
This is a place where I think the story is not done being written yet.
I agree.